Caprine Arthritis Encephalitis, or CAE for short, is now being called by many researchers the Small Ruminant Lentivirus. This is because it's been found that the CAE virus can jump species into sheep and other small ruminants, hence the change in name to the Small Ruminant Lentivirus. But for this talk, I'll continue to talk about CAE. The CAE signs are basically the animals become swollen-kneed and then they become crippled. There's a periarthritis with fibrous tissue built up around the joints then seize. There's also wasting, with the animal becoming very thin. You can get the hard udder form, which is when the udder feels like a smooth rock underneath the skin. There's also nervous forms. These are mainly seen in kids around 4 months of age, starting off with a posterior paralysis, but it can be a range of nervous signs, and in these nervous signs can even appear in adults. There's also pneumonia, where the animal has great difficulty breathing and can't get its breath, and this affects their eating because they have to concentrate on breathing, and that's because the lungs become solid. But in general, these two photos show you the most common clinical signs of CAE: enlarged knee joints and wasting of goats despite good feed. Milk is the main method of spread, and there is no excuse for feeding pooled milk to kids. Not only can it spread CAE, but it can also spread Johne's disease and mycoplasmosis. The only goat's milk that should be fed to kids is that if it is pasteurised first, and this must be done with a great deal of care to ensure that there is no contamination of the pasteurised goat's milk with any unpasteurised goat's milk. It is much more efficient to feed a quality milk substitute to kids if rearing large numbers of kids. The spread of CAE is by a range of means. This is because the CAE virus is attached to the white blood cells of goats. They're actually inside the white cells because they use the white blood cells to reproduce themselves. So any contact with bodily fluids from positive or carrier CAE goats, either directly or indirectly, can spread CAE. Milking machines have been known to spread CAE in goats, and a very tiny amount of backflush of milk from the previously milked goats is all that's needed to infect a goat with the CAE virus. Boarding, leasing, or giving a stray goat a new home are all methods of spread. Mating can spread CAE, though it's more common that the males are likely to get CAE from the positive females, and this is because females in heat have very large numbers of white blood cells in their mucus, and these white blood cells have the CAE virus that the males then sniff and lick and get then infected. Shared needles or shared tattoo equipments, anything that can be contaminated with blood, can also spread the CAE virus. Contact with sheep, which we now know can carry the CAE virus, can also spread it to goats, and similarly, goats can spread CAE to sheep. The CAE ELISA test is actually an extremely reliable test, and this is because once goats get CAE, they are infected for life. Unlike other diseases where the animal can have an immune response and get rid of the disease or infection, in which case the ELISA just shows you that they've had past infection with the disease. Because goats with CAE virus can never get rid of the virus, then the CAE ELISA test is extremely accurate. It has a sensitivity of over 99% and a specificity of 99%, which means very few false positives and very few false negatives. There's research in Australia undertaken at the moment to try and identify bulk milk tests that can be used to determine if a commercial milking herd has CAE. So if we're looking at having accurate CAE tests, then there's a few things that we should really be looking at. You need quality samples for CAE and Johne's disease tests. To minimise false results, you must make sure that the blood sample is treated very carefully so it isn't hemolyzed, which means that the red blood cells are destroyed. It should be let clot while it's still standing. Only then, once it's clotted, should it be chilled, and it should never be shaken or driven over very rough ground without adequate protection. Sick goats should not be sampled, and goats close to kidding, 4 weeks either side of kidding, should not be sampled. Similarly, don't sample within 4 weeks of a vaccination. These are basic tests that apply both for CAE and Johne's disease in order to get accurate samples. However, if one particular sample doesn't make sense, then just arrange to have that particular goat resampled, and this time treat the blood sample extremely carefully. There is no biological test that's 100% accuracy, but test accuracy is increased if it's used on the whole herd tests. Many herds in Australia have eradicated CAE and have kept CAE free for decades, and there's no excuse for not testing because you fear that the test may give an inaccurate result. There is no treatment for CAE. This photo shows a young Nubian goat that's less than 2 years of age, whose joints are already seizing up and the goat is crippled because of CAE. There is no treatment. You can only just give this goat some painkillers for the extreme arthritis that it's suffering. So why should you bother to control CAE? Obviously, this is a disease with no treatment that the animal suffers pain from, so there's an animal welfare reason to control CAE. There's also lost production. Especially in dairy goats, it's been shown that milk production is severely affected. Also, the quality of the milk is affected. If you're selling stud stock, then obviously your purchasers, if they're educated and informed about the risks, will want to buy only from those herds which are in a CAE accreditation scheme or who test annually for CAE. Another reason to control CAE is it puts the Australian sheep industry at risk. Sheep in Australia is regarded as being free of Maidi Visner, a disease that causes mainly mastitis and pneumonia, and in America it's called ovine progressive pneumonia. Australia exports a lot of sheep because of our disease-free situation, and this is put at risk if sheep in Australia are exposed to the CAE virus. There's also consumer perceptions. The CAE virus is from the same family of virus as the AIDS or HIV virus. And while there's no indication that humans that drink goat's milk or eat goat meat will get CAE, it's the perception of having a virus so similar to AIDS in goat products that may affect the purchase of goat products in the future. An example is that there's no scientific evidence that hormone-treated beef cattle has any effect on humans, and yet supermarkets have demanded that all beef that they sell is free from hormone implants. And there's no way of testing beef to see if they've actually got hormones implants in the animals that they were slaughtered. And so there's a whole system of accreditation in order to prove that these animals are not treated with hormone implants. Because the hormones used are actually natural, they just put female hormones in steers. And so you can't test the meat to see if they've been added for hormone growth promoters. But if the supermarkets decide that consumers think this is a risk, then they'll stop purchasing. So, CAE is mainly a problem of dairy goats. It's already in miniatures and dairy goats, but it has also been shown to spread to both meat and fibre goats in America. So you cannot assume that meat and fibre goats in Australia are free. There have been no surveys showing that these boar goats or Angoras are free from CAE. We know that any breed of goat can be susceptible to the CAE virus, and therefore we don't want the situation as has occurred in America, whereas now anyone that buys any goat of any breed must make sure that they are free from CAE virus before purchase. There are overseas CAE accreditation schemes. In New Zealand, there's a Breed Society scheme. In the United Kingdom, there's a monitoring scheme by the British Goat Society, and also an accreditation scheme by a Scottish agricultural consulting firm. This also does the accreditation scheme for Maidi Visna in sheep in the United Kingdom. In America, unfortunately, it is spreading, and now meat and fibre goat owners are warned to consider CAE before purchase. They really lack accreditation schemes in America. In Norway, they have actually successfully eradicated CAE from their dairy goat industry. And not only did they eradicate CAE, they also eradicated at the same time Johne's disease and caseous lymphadenitis. And they did this by snatch birthing kids, rearing those kids in isolation and keeping them isolated for 2 years until they replaced the existing herd. There are 2 ways to eradicate CAE. Firstly, you must stop CAE spreading, so you must stop feeding pooled milk. You must also make sure that any needles that are used on the goats are sterile. Tattoo equipment are boiled before use. Once you've stopped the spread, you should then isolate all carriers behind a solid wall or a double fence and keep testing every 3 months until no carriers are left in consecutive tests, and then you can bring the testing interval out to 6 months and then 12 months and eventually every 3 years. If you have a very high number of carriers, this may not be a logical way to proceed, and so you should use the method that was used so successfully in Norway, and that is to snatch birth all the kids and to raise a second herd that is free of CAE. You must also test these kids between 3 and 6 months of age to make sure that if you've missed any kids that actually had to suckle their does, then you must remove those kids quickly from the other kids to ensure that there's no lateral spread. Lateral spread between kids while they're dry and not cycling is quite low risk. However, those kids must not be allowed to grow up to be mating and definitely not allowed to kid unless they're shown to be CAE negative. Australia has a national kid rearing plan, and that is a process kids can be reared free of both Johne's disease and CAE, and if the National Kid Rearing Plan is followed, there's provision for auditing that plan to make sure that the kids raised by that method are raised in accordance to the plan, and so that potential purchasers of those kids can rest assured that they've been raised in the proper manner. Johne's tests and CAE tests can be combined from the one blood sample, and this makes testing for Johne's and CAE annually something that is to be highly recommended. But what is the difference between accredited herds and those herds that just test on and off? If you're buying an untested goat, then you really have no idea if that goat is a carrier of CAE and or Johne's disease. If you get that individual tested, it's better than nothing. But because these diseases have long incubation periods, then it's not ideal. In the UK, they recommend testing 25 of the oldest and thinnest goats in the herd to get an idea if you've got CAE and or Johne's. Again, not ideal, but better than an individually tested goat. You can then look at a herd that is tested once, but bear in mind that especially for Johne's disease, less so for CAE, that is just the status of the herd at one point in time. Ideally, the herd should be tested annually, but that annual test has to be taken into account the level of biosecurity that's practiced by that herd, because theoretically that herd could have a negative test for CAE and Johne's and the next day go out and buy some goats that are carriers for both diseases and wouldn't know until the next annual test. So the best is to have goats in an accredited or market assurance program. States such as New South Wales and Queensland have a government accreditation scheme for CAE, the same as Tasmania. In South Australia, there is an accreditation scheme for both CAE and Johne's disease that's run by a breed society. Although CAE and Johne's disease are spread by milk and other bodily fluids, the way that most CAE and Johne's disease gets into goat herds is actually on the back of a truck or in the back of a trailer. It's people that purchase goats that are carriers is the main method of introducing these diseases into a herd. So always get a goat health statement. These can be obtained from the website www.farmbiosecurity.com.au. Get that herd health statement well before you think about purchasing the goat. Don't wait till you turn up with your truck to have a look at that goat health statement. And make some serious decisions about the level of risk that you're prepared to take about introducing these two serious diseases into your herd. You need to make sure that you do everything possible to keep them out, and don't wait to have a look at the back of the herd health statement to decide that goat's too much of a risk, because you'll be tempted to buy that goat and take it home anyway, having visited the farm. That must also be combined with good biosecurity, because biosecurity is the security that the buyer has. When you visit a potential farm that you want to buy stock from, have a look at the level of biosecurity. What steps does the owner of the property from which you want to buy your goats take in order to protect itself? Does it have a farm biosecurity sign at the front of its property? Does it make you clean your shoes before you enter the goat yard? Does it make sure that you actually don't enter the goat yard and they bring the goat out to you to have a look at? So the basics are, the easiest way is to keep CAE and Johne's disease out of your herd. If the most unfortunate thing happens and these get in, you need to find it fast if it does get in. You need to have steps that you can take to stop it spreading if it does get in. This includes things like never reusing needles in between goats. It means not reusing tattoo equipment without cleaning it first, and using basic biosecurity. If it does get in, then you need to eradicate it, because otherwise these diseases get worse and worse over time until eventually the herd will crash. If you want to learn more about CAE and Johne's disease, then you need to make sure that you have a look at the website www.goatvetoz.com.au to make sure that you know enough about these diseases in order to keep them out.